All right. Gentleman right here in the T-shirt. Hold on one second. We got a mic coming.
Thank you for coming to Colorado, huh? It's a great place.
It's a great place.
You touched on this. I would like you to expand a little more. This problem with misinformation in our country. It seems to me that it's not only just hurting health care reform, health insurance reform, it's dividing our country. Is it not maybe time, I think we all know where it's coming from. Is it not time that something can be done? Okay, I got to watch what I'm saying. But
well, look, let me address this. You know, healthcare is really hard. I mean, this is not easy. I'm, you know, a reasonably dedicated student to this issue. I've got a lot of really smart people around me who've been working on this for months now. Yeah, we've got really fine public servants like Senators Bennett and Udall who are working on this and thinking about it a lot. And the truth is, I want to be completely honest here, there is no perfect, painless, silver bullet out there that solves every problem, gives everybody perfect health care for free. There isn't. You know, I wish it was. I wish there was. I wish I could just say, you know what, we're going to change the system. Everybody will get as much care as they want, anytime they want. Everybody will have it, and it won't cost anything. And doctors will be happy, and nurses will be happy, hospitals will be happy, insurance companies will still make a lot of profits, drug companies will be able to charge as much as they want. I can't do it. Nobody can. What I can do is try to sort through what are all the options available, be realistic about where we're going on health care, say to myself, if we keep on doing what we're doing, we are in a world of hurt. We can't afford what we're doing right now. More people are going to lose health insurance. More employers are going to drop coverage or push more coverage onto their employees with higher premiums and higher deductibles. Medicare and Medicaid will go broke. State budgets and federal budgets will be unsustainable. And then we're going to have to make some really bad decisions where we have no good options, even worse options than we have right now. And what's going to end up happening is, mark my words, if we do nothing, at some point, Medicare in about 8 to 9 years goes into the red. Somebody mentioned it's going broke. Yeah, it is going broke. So here's what's going to happen if we don't change the delivery systems and change some of the incentives. We'll have a choice. We'll either have to cut Medicare, in which case seniors then will bear the brunt of it, or we'll have to raise taxes, which nobody likes. And we still will be paying about $5,000 to $6,000 more than any other advanced country in the world and not get better health care for it. Now, that doesn't make sense. So, in terms of misinformation, because there's no perfect solution, we can have legitimate debates about the public option that we just had. That was a good, serious debate. And you can make a plausible argument as to why we shouldn't have a public option. Now, I believe that we should, on balance. It's not perfect. It's not going to solve every problem, but I think it actually would keep the insurance companies more honest. You can have an honest disagreement with me on that. What you can't do, or you can, but you shouldn't do, is start saying things like, we want to set up death panels to pull the plug on grandma. I mean, come on. I mean, I just... First of all, when you make a comment like that, I just lost my grandmother last year. I know what it's like to watch somebody you love who's aging deteriorate and have to struggle with that. So the notion that somehow I ran for public office or members of Congress are in this so that they can go around pulling the plug on grandma? I mean, when you start making arguments like that, that's simply dishonest, especially when I hear the arguments coming from members of Congress in the other party who, turns out, sponsored similar provisions. Here's what this was about. Here was the genesis of this little piece of information. We had a provision in the House bill that would give the option of somebody getting counseling on end-of-life care or hospice care and have it reimbursed by Medicare. The option, voluntary, so that you'd have more information about how to deal with these situations. Turns out the biggest proponent of this was a Republican congressman who is now a senator and a colleague of Mr. Udall and Mr. Bennett. Turns out in Medicare Part D, which was passed by a Republican Congress, they had the exact same provision. So when I have people who just a couple of years ago thought this was a good idea, now getting on television suggesting that it's a plot against grandma or to sneak euthanasia into our healthcare system, that feels dishonest to me. And we've got enough stuff to deal with without having these kinds of arguments. All right. So, it's all right.